Well, welcome back to Good Morning Vail. Dr. Donald Corenman has joined me. He's here to represent the Steadman Clinic. We're going to talk about something very interesting today, something I hadn't thought a whole lot about, and that is back pain in children. Good morning.
Good morning.
Thank you so much for coming in.
It's my pleasure.
This is an interesting topic. I don't necessarily think of kids having back pain. Obviously, us adults, it seems to be a chronic thing.
Right, but in kids, it's actually relatively common.
Really?
And many docs will see kids with back pain, and because it comes intermittently and kids don't complain, it's not really pursued. But back pain in kids can represent a condition that 1 in 20 kids has, that is a fracture.
Really?
Yes. It's a stress fracture, just like taking a coat hanger and bending it enough times so it actually breaks.
Yeah.
The bone will do the same thing.
I had no idea. Well, kids think they're invincible.
Exactly.
Oh, yeah.
And they try and ignore everything.
Right, right.
And, you know, as a parent, the kid won't complain to you. And so your child, if he starts to have funny gaits or sits funny or has issues, you really have to pay attention to that.
Is it upper back, lower back, or can it be anywhere?
Sorry, it's lower back.
Lower back, okay.
Yes.
You have some pictures that are going to
Yes.
reflect this and give us a really good idea of what you're talking about. We're going to put those up. First of all, this one.
So this is a typical side view of a spine in the lower back. And everybody has an idea of what the spine looks like.
Right.
You can see the disc in the center and the nerve coming out. And then in the back, you see this little hook called the pars interarticularis. It's a fancy Latin term that just means area between the two joints.
Okay.
And that's the area that can get stressed and break.
Really? And then let's move on to the next
Yes.
picture, because does that show an actual stress fracture?
This is an actual stress fracture. It's a CT scan of a young boy, 12 years old. And if you look at the arrow, you'll see a little break in that bone.
I do see that.
And that's what causes this back pain in these kids. If it's recognized early, you can treat it and it'll heal. But if it goes unrecognized, let's go to the next picture.
The next picture, is that just looking down?
This is exactly right, looking
Okay.
down, and the arrows are pointing to the fracture itself.
Okay.
And that fracture, if the kid continues to do the activities that he normally does, it won't heal.
Does that build up like an arthritis or something in
Well,
there?
that's the next picture.
Oh,
So
jumping
let's
ahead,
go
sorry.
to the next picture here.
Okay.
This is what happens when the condition sits there for a long time. The vertebra actually slips forward. You can see the small arrow on the bottom, and the large thick arrow points to the area where the fracture never heals, and the long arrow points to the nerve root and the bone spur that presses into it.
So then you start getting that pain because it's pressing into that nerve.
Exactly.
Okay, and then you do have one final picture here. What does this one represent? Wow,
This-
you can look, it looks displaced.
Yeah, exactly. You can look at the vertebra and you can see the vertebra slipped forward. And this is the end stage if you don't catch the fracture early. That's why it's so important to pay attention to kids.
And then what are the long-term effects of that?
Some patients have incapacitating back pain and need surgery.
Really?
Some patients can live with it, but it's really an issue that needs to be identified early.
So it's just something to be aware of. I mean, if your child is talking about any back pain or has been in an accident recently or something like that.
But most of these kids don't have an accident. It's a chronic,
Just-
it's a chronic stress.
Well, they're growing so fast.
Exactly. Yes.
Well, obviously, that's something you want to follow up on immediately. And you are with the Steadman Clinic.
Correct.
They can just call them directly if they need to set up an appointment with you and get further information.
Yeah, that'd be fine.
Terrific. Well,
Thanks a
I thank you
lot.
for coming in. That's very interesting information,
My
definitely.
pleasure.
And if you would like further information, you can call the Steadman Clinic. Dr. Donald Corenman is a doctor at the Steadman Clinic. And the number to call is 479-5895. Is that the number?
fine, yes.
Or you can call 476-1100 as well. We'll be back in just a moment.